All right, it's live. Hello everyone, and welcome back to our next virtual dental shadowing session. I want to remind you that in order to get your hours, we will have a quiz at the end, and it will be linked in our bio. And in order to get your hour, you have to get a 3 out of 5. All right, let's get started. Today we are very fortunate to have Dr. Mahmoud Farhat. I'm handing the mic to you. Feel free to start whenever you want.
All right, thanks, Scott. Thanks for tuning, guys. My name is Dr. Mahmoud Farhat. I'm a general dentist in Dearborn, Michigan. I'll go through my slides. So here's a little bit of background info. Like I said, I'm a general dentist. I practice in Dearborn, Michigan. I got my bachelor's in biology from the University of Michigan-Dearborn. I then I actually applied to dental school the first year. I actually didn't get in, and then I ended up doing a master's in human physiology at the University of Michigan, and I then got in, and that I got my DDS there, class of 2018 at U of M. Right after I graduated dental school, I worked for a corporate office, Great Expressions Dental Centers. I worked there for a year. Right after that, I started my own office, which is Zenith Dental Care in Dearborn, Michigan. Just a little quick background, just for some people that are pre-dental, a little bit confused about, what to do. We don't know which direction we're heading, things of that sort. I was in that boat myself. I actually graduated high school in 2006, and I didn't think I wanted to go to school at all. As a matter of fact, so I was a mechanic for about 5 years, and then I decided I wanted something a little bit differently, and it took me basically almost 5 years for me to decide that I wanted to pursue dentistry. So some of us may be a little bit confused, and some of us feel pressure, external pressure, internal pressure to choose something and commit to a particular career or something of that sort. So my recommendation is take your time a little bit and make sure you find something you really like. And obviously, if it's dentistry, really spend some time learning a lot about it. It's a beautiful career. You'll be seeing a little bit of work that we do. It gives you a little bit of insight on a little bit more detailed picture that you normally wouldn't see if you were just shadowing in the office, because this is a little bit more detailed. So this is the most asked question from current dental students, pre-dental students, that we get asked. My sister is actually a first-year dental student at Michigan, and her first question is, how should I study? What things should I do? And one thing I always tell people is competition, but make sure it's healthy competition. Healthy competition means people that also want the best interest for you, not people that tell you, oh, I did terrible when they did great, they're like gunners. They don't tell you how good they're doing, so that way they stay ahead of you. These group of guys, we all went to school together. We're like brothers, and that's basically our like-minded support system. We pushed each other every day. We pushed each other to excel, both from a didactic perspective. We also pushed each other from a clinical perspective. Let me see your preparation. How can I make mine better? What are you doing? I go to them, ask them what they're doing, what's working for them. And you want people that are goal-oriented. One of the guys in the picture is an orthodontist. The other guy did a 1-year residency after school, one top residencies in the nation. Right now, he's in a practice out in Jersey. Excellent provider. My two other friends, each are in their own private practices. They own private practice. So goal-oriented, driven people that are going to push you to be better and continue to get better. And the best part about it is you guys are all doing the same thing. All your classmates, you guys all have a class, you all have an exam, you have to take it together. So there's no better motivation than that. It's a little bit differently than undergrad, or where your friends are, studying for bio, whereas you're studying for chemistry and you have an exam and they don't. and so on and so forth. In dental school, everybody's doing the same thing almost always together. So good support system, my opinion is going to be the best motivation. During dental school, we did some community service. You just got to do something you like, in my opinion. We did a mission trip to Jamaica as third year dental students. This is us, our instructor, and a couple of my friends. We went, Jamaica, and into the villages, extractions, things of that sort. People that don't normally don't have access to care. People that would otherwise have their face swollen, infected. They come to us, as you can tell in this picture, in a church, sometimes in a school. Very rudimentary way of treating people, but this is the best care that they were going to get, and to be able to give back and serve these people is a great humbling experience. In addition to that, during our 4 years of dental school, we would go out to high schools, middle schools, and do some oral health education about the importance of oral health, and things of that sort. Again, yeah, everybody has their own way of giving back, and those are some of the ways that you got to find what you enjoy, in my opinion. So, and those are some of the things that we enjoy doing. Choosing specialty. This is a very interesting point because up to this day we continue debating it. 3 years into practice, we continue to debate it. I'm a general dentist, and I for me it was focusing on what I wanted to do, and what do you see yourself doing for the rest of your life. For me, I was a little bit older. Like I said, it took me 5 years out of high school for me to decide that I wanted to go into dentistry. So I was a little bit behind the curve, a little bit in school. Going into dental school, I was 25 years old. Graduating, I was closer to 30. So specialty was a little bit off the table for me. I was married. We were ready to start our life. So specialty was a little bit off the table. One specialty I would have chosen would have been orthodontics. It's just lifestyle. The lifestyle and the job is just very. It's very rewarding. You don't have to work as hard. Especially what we do as general dentists is a little bit physically demanding, in my opinion. And being an ortho is much easier on you long term. For me, things that would impact your decision on what specialties to choose. For me, it was just personal limitations. Like I said, I was married, and I was a little bit older, so it wasn't a very easy decision per se to make, to decide to go to school for 2 to 3 more years. And I really enjoyed general dentistry. I had personal goals as a restorative dentist. And you'll see some of the cases that we do. I love the ability to be able to do a very diverse aspects, we like to call it multidisciplinary approach to restorative dentistry. And you'll be able to see some of that today. So those were my reasons. Typical days, like, general dentists, our days are very diverse. Today, maybe I had 4 out of the 5 things listed, Invisalign, extractions, fillings, crowns, implants. We're able to do all of those. We're able to focus on what we enjoy doing, and we're able to not do what we don't want to do. For example, I hate doing root canals, so I choose not to do them. So I just send them to the specialist. He loves me for it, but I just send them to the specialist. I just do whatever I enjoy doing. And I always focus on what I enjoy doing. So I just basically honing your craft. So a typical day, honestly, it's very, very, very diverse, which I really like. It's not monotonous, not repetitive. I get to do what I enjoy. There's always obstacles with treatment planning patients, especially in a general dentist office setting. As an orthodontist, you go to the orthodontist, you're getting braces. You go to the oral surgeon, you're getting your wisdom teeth extracted, for example. You go to the root canal specialist, you're getting a root canal, right? So as a general dentist, it's a little bit diverse. It's a little bit more challenging, I would say, because of the various options. Not everybody needs all of their teeth restored. Some people do, some people don't, and some people might want them, and some might not. So it's there's a lot of challenges in deciding the most accurate and appropriate treatment plan. And just because you have a treatment plan does not mean it's incorrect. Everybody has their own treatment approach. So obviously, some limitations and obstacles regarding treatment planning. Um, patient's insurance. They may dictate things you can and cannot do. Financial limitations. Not everybody can afford. Um, extensive dental care, and some people are on time frames. Some people don't live locally. Some people are traveling all the time. Some people work too long, and they just can't come to the dentist so frequently. So you got to take a lot of this stuff into consideration, and it'll help you come up with the treatment plan that fits that patient most effectively. All right, so the fun stuff, I guess. This is our first case. So this is a patient, 18-year-old female, no significant medical history. Patient comes in because she does not like her gap, obviously, in her front teeth. We went through the treatment plan, went through her concerns. And as we can tell, the side teeth next to the two front teeth, those are called the lateral incisors. They're a little bit smaller relative to the rest of her teeth. So we gave her a couple of treatment plan options, and always the goal in dentistry is for us to be as conservative as possible and respect biological tissue as much as we can. Meaning, we don't want to just drill teeth just because we can, right? Just because we have a diamond burr that can cut teeth doesn't mean we should use it all the time. Sometimes it's necessary, not all the time. So we provided this patient with a couple of treatment plans, and like I said, she's 18 years old, so we really want to be ultra conservative. So I'll go through how we treated her. So this is her before. Again, smaller teeth on the side, space in the middle, beautiful teeth nonetheless, beautiful color to her teeth. So that wasn't a concern at all. Spacing, that tooth has a chip on the front tooth, smaller side teeth. And so the treatment plan, basically, what we decided to do is we decided to close the gap with Invisalign. So this is the multidisciplinary approach to general dentistry, is our ability to be able to do that. So we used Invisalign for about 4 months, closed her space, as you can see here, created space around the side teeth, which were already small, prepared those teeth a little bit so we can tell the lab exactly where we want those teeth to end. This is, we call that a spot etch. This is for cementation of the temporary. This allows us to stay away from all the margins around the tooth and just localize our cement to stick into one area. These are her temporaries. This is basically how the patient walks out that day. As you can tell, these are handmade, chairside fabricated. We can do a pretty good job getting that very, very close to what we expect. So basically, patient walks out that way, same day. These are the final veneers inserted 2 days after follow-up. And we can see a balanced final outcome. We did very minimal invasive dentistry. We only prepared 2 teeth on her. We relocated spaces. We moved the space from the front middle teeth to the side teeth. So we can, because the side teeth were already small, they already needed to be added. And this to me is the most profound outcome. This is how we see what we did. I like to call this, micro dentistry and macro dentistry, right? You can see the face and you can see the impact 2 teeth had on this girl's face. I think it's a profound outcome. Again, 18-year-old, beautiful smile now, and very, very nice, cohesive result. Very natural nonetheless. So that's first case. Second case. This is a little bit more interesting. It's a little bit more difficult, obviously. This one is a 25-year-old medical professional. Interestingly enough, her husband is one of the specialists I refer to. He chose us to do her teeth, which was, a big compliment for us. So, he sent her in. He said, "Hey, I don't like the two front teeth." She didn't like the two front teeth. One was a little bit darker. We discussed it. We decided that it would be best if we actually end up doing four because she had some old fillings on the side teeth as well. So her treatment plan included whitening. We whitened all of her teeth. We prepped her teeth, and then we only did four front teeth. So we'll go through this a little bit. So dental case two. Again, you can tell the distinction in color in the between the two front teeth. Obviously, the one to the patient's left or to the right, if you're looking at the screen, it's a little bit darker. There's a space in the middle. We call that a black triangle. The side tooth to your left, it has a filling stained a little bit on the front part of it, and just a little bit not balanced of a smile, right? And a little bit of wear on the edge, on the chewing edge of those front teeth. And again, so the patient walks in like this, walks out like this. These are temporaries, chairside fabricated. Patient walks out like this. Patient is able to test drive this. What we do is we actually take a copy of this, send it to the lab, and tell the lab, hey, this is exactly how I want my teeth to be. Make sure you replicate those. So we're able to have that much control rather than prepping teeth, sending them to the lab and saying, hey, cross our fingers and hope something nice. We can actually have a lot more control over saying, no, this is exactly what I created. This is what fits this patient's face the most. And I'd like for you to replicate that. So this is the temporary, that's how the patient walks out. One side note on this case, we had to do this 2 weeks before their wedding, and they didn't give me enough time. So it was a very high pressure case. Also, he's my specialist. So basically, this you got to follow along here just a little bit because it gets a little interesting. So the right side of the screen, the two front teeth, those are her veneers. We're just trying them in side by side with her temporaries. And this is a confirmation of our design. And this is a confirmation that the lab followed what we designed. So basically, we put them side by side. I confirm this is the design that me and the patient agreed that we liked, and the lab was able to replicate that. So as you can tell, it's extremely close. Right side of the screen, two veneers. Left side of the screen, two temporaries. Very, very close. And then this is the final water try-in. So this is us trying in all four teeth, making sure everything is fits well, making sure everything is what we planned in a sense. And obviously you can see only four teeth in the profound results and outcome. And this is 3 days post-op, just a follow-up. Again, this was, I basically saw her the day before her wedding. She came in and we made sure everything was good. She was comfortable and yeah, so that was, so this is our second case. 4 teeth, again, goal, improved aesthetic outcome. Everything is very well balanced. Color matches really nicely. Very, very natural aesthetic outcome. So this is our second case. And this is our third case. This one's interesting a little bit because this patient came in, she came in for a consultation. And she came in for a consultation because she wanted Invisalign because she wanted to close her space. And if you just look at these teeth, you can tell it's very easy to point out that these teeth are smaller. They're smaller teeth. They're malformed. So we would call these peg laterals, where her side teeth are smaller than they're supposed to be. These are significantly smaller. In addition, the patient disliked the discoloration on her teeth. So you can kind of see that from the side view. Um, and treatment options, right? First treatment plan is doing Invisalign or orthodontic treatment, correcting all of this rotation, right, and then prepping 8 teeth. Um, it's a valid option. The patient would have to pay for Invisalign and then have to pay for 8 teeth. And the second option is what we like to call is restoratively driven orthodontics, which is doing restorative dentistry with the goal of achieving a straighter outcome. And that's what we're able to do here. This allows us to be more efficient. A 3-week process, 3 to 4 weeks. We were able to, provide a way more balanced outcome. We wanted to improve the color anyway, so we prepped 8 teeth. We improved the proportion of the teeth profoundly. And as you can tell, the patient is a very, very nice and balanced outcome. So again, this is, I post a lot of the stuff on my Instagram, the photos, that's why you'll see some photos, and all of them are gonna be a little bit different because, different cases just present differently. And I like to do this because, it's great education for me, for the patients, for other dentists, for obviously pre-dental students in that sense. So you'll get to see a lot of that stuff on my page as I do them. So again, this is her before, and then the pictures will point out. This is a darker lower tooth on the bottom. In addition, these teeth have some internal discoloration, as you can see pointed to the arrows. Rotated canine, that tooth is rotated around its axis. Spacing, that's obviously very evident. And smaller side teeth. So obviously the outcome, the objective of the treatment is to correct all of the above, right? Correct the rotation, correct the spacing, correct the smaller teeth, correct the discoloration, provide her with better proportion. And that's kind of the thought process that goes in. Would doing Invisalign have provided her with a better outcome? 4 months of orthodontic treatment, 4 to 6 months of orthodontic treatment, would it really have provided her with a more superior outcome? That's just a personal decision. In my opinion, no, because we were able to achieve a very well balanced outcome without spending the time in ortho. And one thing that we have to always take into consideration is her teeth have been in this position for all her life, right? I think she's 25. So her teeth have been in this position all her life. This is the most stable position her teeth are in. If we begin to move these teeth orthodontically, we're going to begin to destabilize that tooth, the integrity of that tooth, and the integrity of the surrounding tissue around that tooth. Now, over time, it'll heal, assuming everything goes well. But this, where this patient is today, is the most stable position she will ever be in. Obviously, dark tooth here. Doing 8 veneers on her, we were able to establish a more natural and aesthetic outcome. Very well balanced. The colors improved significantly. Regarding the lower tooth, we were able to correct the discoloration doing root canal and something we call internal bleaching. That's a little bit more in depth. I'm not going to dive into it too much, but basically we put a material after we do the root canal on the inside of the tooth, and we basically do that over 3 appointment sessions, and the color will continue to dramatically improve, as you can see here. So a dramatic improvement in the color. We don't have to do anything, veneering or anything like that. So that's all her natural tooth. We did zoom whitening, obviously, to brighten up the rest of the teeth, so everything can match really well. We corrected the rotation of the canine restoratively again. We could have done that orthodontically for 4 months or so to just turn that tooth. We were able to achieve the same result restoratively. So I think we're able to do that. Spacing was eliminated. Obviously, we're able to provide her with better proportion, um, better weight distribution of the teeth. So basically, we moved that space that was there in the middle and kind of spread it across the back teeth as we go back. This is just a little bit of insight. I think this is pretty cool because even a lot of dentists now ask me about this. Say, hey, like, what do you tell your lab? Like, how do you tell your lab? This is basically a picture of my temporary, and this is a hand fabricated temporary, something that I created chairside, and basically, as I see the patient, I follow up with this patient. We begin to see things a little bit differently. The patient begins to point out, hey, I like this tooth, I don't like this tooth. I like this tooth to be a little bit wider, a little bit narrower, things of that sort. So this is basically a little bit of how we communicate, how I like to communicate with my lab. Everybody likes to do a little bit differently. This is just how I like to do it. I learn by doing, and I learn by showing. So basically, I draw to my lab what I want to see. So basically, I'll take a copy of this impression and I'll send it into the lab, and the lab will 3D print it or stone model, and they can do the build out basically just as I tell them, and they're able to change what I created in my temporary into the final porcelain. And again, as you can tell from all of this, the objective always is not to allow the lab to be in control. No matter how good your lab is, we want to be in control because ultimately the patient doesn't know which lab you chose. The patient doesn't know, did you use the best lab in the country or did you use, somebody next door? The patient just cares about the final outcome. And when somebody looks at a picture, they don't see it and say, "Oh, the lab made him look good," right? They say, "Oh, look at how nice his work is," right, or her work is. So the objective is for you to be in so much control, and you want to guide your lab onto every step, so that way there's no guessing, there's no taking impression, send it in, because the lab doesn't have the patient's face there, right? The temporaries and you, the provider, and the patient are the best people to determine the final outcome for the patient. So you have to be in so much control to tell the lab exactly what you want them to do, and provide you with the most accurate representation of your porcelain. And that's why in the previous case, we do that for all the cases. We section one side of the mouth, we try in the veneers, and we try them side by side to make sure what the lab gave us parallels what we have in the patient's mouth. That's why, to me, the temporary phase is probably one of the more important phases, because we're able to test drive, the patient's able to test drive their smile. Unlike any other cosmetic procedure that we can do, you can't go to your plastic surgeon and say, "Hey, show me how my nose will look," right? You can't do that. With dentistry, almost always we can. Very little times we cannot. We can literally show the patient how our final outcome will be. And always the goal is to work with the goal in mind and work backwards. So always what we do is we overlay the temporaries first. So basically we put the temporaries on the patient's mouth first, see how the final outcome is going to be, and then cut back from there, and then prepare the teeth according to how the final outcome is. So basically, you start with the end in mind, you go back to the beginning and work towards the end goal. So lab communication is extremely crucial to allow us to achieve a predictable and a successful final outcome. And that's how you're happy, your patient's happy. The lab is happy. Obviously, you communicate very well to them. You're very accurate in your communication. So, to me, this is one of the most powerful tools that we use in our office. So this is basically side profile a little bit enlarged compared to the other photo. And this you can see obviously the profound difference on this patient's face, and just this patient's personalities just comes out. It's such a profound difference and profound impact that you can make on these patients' lives. Because I had a patient we just delivered 20 teeth on, and she literally was crying during our follow-up because she said she hasn't smiled in God knows how many years. She doesn't want to show her teeth. And the impact that we're able to have on those patients, it's so profound that we're able to change their life in a sense, right? Patients like this, their confidence skyrockets, their personality comes out. They're able to smile more, show their teeth more. This is what I truly enjoy about general dentistry. My ability to be able to do this. We can do a combination cases. When I was putting this presentation together, I wanted to demonstrate, the various aspects, the diverse aspects of general dentistry, and how we can tie in a lot of specialties into what we do. And for me, I want to have a lot of control over the final outcome. So um, we're able to guide our treatment based on how we want our final outcome to be. And this, to me, this is the power of dentistry. And you know, one of the question was, would you have chosen a specialty? And one of the main reasons I didn't is because I wanted to do work like this. And this is basically the kind of dentistry I strive to continue to achieve. We're always continuously learning. One of the biggest things we always have to take into consideration is we can't stop learning. This is ever changing. There's always something new coming out, always different materials coming out, things of that sort. So that would be kind of just stay focused, enjoy what you're gonna do, and it's very, very, very exciting in my opinion. So, and that is it. Those are just some a little bit of the fun cases that we got. So
Thank you so much, Dr. Mahmoud. We have some question in the chat.
Yeah.
So the first question is, for your mission trip, was it self-organized or did you join other organizations for it?
Was it sub-organized? Is that the question?
Yeah. Self-organized, yeah.
Yeah, so it was actually, so it wasn't like an official school mission trip, but it was organized. It was organized by one of our faculty at the school, and actually another faculty member at Tufts University. So we went, Michigan students and Tufts students there. So it wasn't like an official, I guess for political reasons, it wasn't an official dental school sponsored trip. It was more of like the faculty organized that himself. So it was basically through a faculty member at school.
Okay, thank you. Next question is, how long did it take to eventually feel comfortable working as a dentist?
How long did it take to eventually feel comfortable working as a dentist?
Yes.
That's a great question. Depending on what kind of dentistry you're doing, right? So again, so I graduated. I graduated in 2018, and when I got a job at Great Expressions, I was the solo dentist there. That was actually one of the things I wanted. I wanted to be a solo provider, and basically I had to go in, and there was nobody to fall back on. So I just had to kind of learn as I went. I was pretty comfortable, honestly, graduating dental school. We had finished a lot of our competencies a little bit early. Doing the mission trip allowed us to excel in our extractions, surgical skills. So we've had a lot of exposure to that. Just graduating from our school, honestly, we had a very, very good clinical experience. So I would say I was relatively comfortable. Obviously, I'm not going to say I was great graduating, but I would say a year or so in, that's when I opened up my practice, and I felt pretty solid doing all aspects of dentistry. Again, like I said, I don't do root canals, right? I was never comfortable doing that, and I still don't do them. So it's basically depends on what aspects of dentistry you're comfortable with and you want to do. I don't think I'll ever be comfortable doing root canals. Meanwhile, restorative dentistry, I do a lot of it. I'm extremely comfortable doing it now. Very confident. I don't, you know, maybe my first couple of cases I would lose sleep over it because a little nervous. You don't know what to expect. Patients' expectations are high. You're doing a cosmetic procedure, things of that sort. So those were stressful a little bit. But the more you do, the more comfortable you become. And I would say maybe like a year or so after school, I was pretty autonomous to be able to do a lot of aspects of dentistry very comfortably.
The next question is, what kind of significant medical history will cause a change in treatment plan?
That's actually a great question. Great question, tricky question, right? Because so hypothetically speaking, let's say a patient is missing a tooth, and based on that missing tooth, you have multiple options. So option one is I always like to give my patients options. So basically, we're going to say good, better, and best option, right? The best option is an implant. The better option is a bridge, and the good option is something removable that comes in and out. So basically, let's say the patient wants the best option, but the patient is diabetic on blood thinner medications. Patient has had osteoporosis, has taken medications for bone loss. Those will impact the treatment plan. So now the patient may not be a candidate for the best option, which is the implant. So now you're forced to pick another option. So basically, but if the patient has all of these medications controlled, now it's or medical history is controlled, then you can, the treatment plan changes. So basically, if it's uncontrolled diabetes, uncontrolled osteoporosis, osteopenia, things of that sort. So that's just one point in which your treatment plan can be modified. Again, diabetes, osteoporosis, blood thinner medications, heart failure, things of that sort.
Thank you. How do you face difficult patients? For example, a patient who have different views or complains a lot.
Just tell me the last part of your question. How do you different views
or complains a lot?
Complains a lot?
Yeah.
You don't treat them.
Oh.
No, I mean, look, everybody has their reasoning, right? Everybody has their own reasoning, and everybody comes with with their own treatment plan in mind, right? The third case I showed, actually, the second case, right? The second case, he's a specialist, right? He's a dentist, a specialist in dentistry, and he thought 2 teeth would have been sufficient. So patients come in with their own treatment plan in mind. What we like to do is, what I like to do is something called a direct aesthetic mock-up, which is basically showing the patient during our consultation. Basically, what I do is I book an hour for every consultation, and we sit and chat, learn more about the patient, make sure I'm a good fit for them, and make sure they're a good fit for me, right? And we do something called a mock-up. We're able to show them how I'm able to show them what I'm thinking. I'm able to put it in their mouth and allow them to see it. It's so much different than to tell them, oh, you need 6 teeth and walk out, right? You just can't do that. You have to show them why they need 6 teeth. In the second case, I had to show them why they needed 4. In the third case, patient came in, but I'm doing Invisalign, right? And I had to show her why restorative options were a better option, a better fit for her. So to answer your question, long story short, is basically educate the patient about what your perspective is. I don't do things that because the patient wants me to. Honestly, I'm at a point where I'm comfortable with what I'm doing. I'm going to do what I feel is best fit for that patient. The patient may have different views. Some patients will tell you like, oh, Dr. So-and-so is willing to do it. Then let them do it. That's not something, is that doctor wrong? Absolutely not. But it just doesn't fit my practice philosophy. So basically, just sticking to what you do, never be forced into doing something you're not comfortable with. And the ultimate outcome with every treatment, any provider should be a happy patient. Now, we do whatever it is to make sure our patients are happy as possible. That's how my business grows. That's how I get referrals. I don't do any marketing. All of my growth is from patients that we've treated. So we strive to make sure everybody's happy. If somebody is not going to be a good fit for you, you just, if they want you to do something you're not comfortable with, you just don't do it. Just do what you believe is the best thing to do for that patient. And one thing I tell people is, if that treatment you're not comfortable doing it on your mother, your brother, your father, your sister, never propose it to the patient, right? If you feel that this treatment plan is a little bit compromised, tell the patient up front, right? The last thing you want is something failing, and it's failed because you, the patient. So just make sure it's an ethical treatment, something type of dentistry you want in your mouth. And I don't think you can disappoint many people that way.
That's interesting. The next question is, what is water trying?
Great question. That's actually a very good question. So a lot of dentists don't do that. So just so you know, I'm going to go back to it. Is my screen going to still be visible, right?
Yes.
Okay, great, excellent. So water trying. So basically, you can do this with two different ways. This is basically, we want to try in the veneers on the teeth, right? The veneers are dry, the tooth is essentially dry. We use a water-soluble gel. A lot of times, some people put a little bit of drop of water. I actually like to use a gel because our gel can also be shade matched to our final cement. So basically, say there's a tooth that's darker underneath and you want it to be brighter. So what you do is you use a Trium paste, which is a Trium gel that's a little bit brighter, that parallels your final cement. So basically, you use that gel and you put it on. So basically, as soon as you take off that tooth, it's only water. It's not cemented. It's not fully in. So basically, you would put everything in using a water-based, water-soluble gel, and that way to confirm everything fits really well. And as soon as you're done, you just take them off and you rinse it off with water. It's a water-soluble gel. And it's a lot of times it's the one I use at least is color. So basically, it's the shade is matching with the final cement. So basically, we have a yellow Trium paste and a yellow cement, for like a better term. We have a clear Trium paste and a clear cement, and a white Trium paste and a white cement. So they kind of go with one another. So that's basically, it's just a water Trium. So basically, it's just water soluble. We wash it as soon as we're done.
Okay. The next question is, what is Etch used for?
Great question. Another excellent question. Etch. So, what Etch does, so basically, if we put glue on this tooth just the way it is, it won't stick. This temporary will break right off. So what Etch does, Etch is basically, it's an acid. So this is phosphoric acid, actually. It's a blue phosphoric acid. And what it does is it increases the surface area for retention. So the way fillings stick onto teeth is by something called micromechanical retention. So basically what we create is we create these grooves in the teeth, obviously microns thin, and it allows our cement to penetrate into the area. And that's how the filling is able to lock onto the tooth. And as you see here, I only put it in a localized area in the dead center of the tooth. The reason that is because when I go to cut it off, when I go to cut off my temporary, only that etched spot is cemented. Everything else around it is not cemented. All of that is just free floating. So this allows me to stay away from my margin entirely. So that way, when I go to deliver my final veneer, I know I didn't touch my margin. I only touched the middle of the tooth. And this allows us to, again, it creates a micromechanical retention for increased surface area for locking in the material, the dental material, whether it's bond, composite, filling material, cement in this case. That's a great question too. This is actually one of the more important parts of, there's we get asked this question a lot with, current practicing dentists is everybody wants to learn, how do I prep veneers? What do I do? How do I prep veneers? And my biggest point always, it's not how you prep veneers. That's the easy part. Temporizing veneers is the hard part. Delivering veneers is even harder. Prepping them is, relatively, we're prepping teeth every single day. We're prepping crowns every single day. We're prepping fillings every single day. But prepping, temporizing veneers, that's not done often. Delivering 8 units, 10 units, 20 units all at once, that's not done often. That's the harder part of dentistry. So this it's a very interesting slide, and that's why I took this picture obviously during my delivery process or during my preparation process, because it's such an important step. This is how we cement our temporary and we keep our material localized to a certain area.
I think I've mentioned this before, but in case 3, how do you correct internal discoloration?
The discoloration, right? So assuming, is your question assuming we're not going to do, your question is assuming we're not going to do veneers?
No, but more like for internal discoloration, and you have to like bleach it. Do you have to do like root canal, or?
Are you talking about the dark tooth, or are you talking about the upper left teeth?
The upper left teeth.
Okay, so there's two things. So in this scenario, no, we did not do root canals on any of the teeth except the lower one that's discolored, and that's because that tooth was necrotic, which means that that's the only tooth that had a root canal. All the other teeth did not receive the root canal. And just a side point that's extremely important is every single thing that you see here is individual teeth, and nothing is splintered with each other. So each tooth is its own independent entity, just as a side note. So internal discoloration, just to answer your question, assuming I understand it correctly, there's going to be 2 ways, right? One of the ways is for us to veneer it, which is putting a layer on it, which is what we did. The other thing, assuming we're not doing veneers, we just want to correct the discoloration. It depends on what type of discoloration. There's something called icon resin infiltration, which is a very non-invasive way to correct the teeth. The discoloration, which penetrates through the outer layer of the teeth and it creates a uniform final outcome. That's one way. The other way, I would say, depends on the type of discoloration. I always advise patients do whitening first. See if that discoloration becomes more camouflaged. See if we're able to enhance that color, and then we make a decision thereafter. So basically, you do external bleaching or resin infiltration. Now, if you really want to do internal color change to the tooth, just like that dark tooth, in my opinion, you have to do probably root canals. I don't think you should be doing root canals on vital healthy teeth. Just to be clear, you're only doing it, in my opinion, I'm only doing root canals on teeth that are necrotic, which is why that tooth is black in that area, or darker rather. I hope that answered your question.
Yeah, for the last 2 questions, and it's still the same case. How did you correct the rotation?
That is a great question. So basically, does my cursor work on here? Yeah, right. Can you see my cursor, right?
Yes.
So, great question. So say this tooth. I'm going to start with this tooth because it's easy. It's an easier concept to explain. This tooth is inward tilted, right? We see that we call it an axial inclination, right? So the inclination of this tooth, it's inward, it's tilted inward. So in order for me to achieve my final outcome, I have to build that tooth out. So it's so much easier for me, just like a nail. If this tooth is backwards, I just put something on top of it. Very, very simple, right? Now, if this tooth is already sticking out, I can't just put something on top of it. This will become significantly protruding out, right? Especially from the back side of that tooth. So basically, what we do is now we're going to use our imagination a little bit, right? We're going to be dentists, so our 3D perceptual ability has to be strong. So we're going to split this tooth in half, right? This half of this tooth is inward rotated. This half of this tooth is outward rotated. So meaning we're going to have to add here and then take away here. So basically our preparation would be a little bit more aggressive on the back end of this tooth. When I say a little bit more aggressive, we're talking a millimeter more, right? So it's very small, but a little bit more aggressive. So basically we would have to cut back this a little bit more than what we would cut back on the front part of this tooth. So when we cut it back more, we're basically de-rotating that tooth by tucking that backside of that tooth inwards more. And then we build it out using porcelain, just like the concept I explained on this tooth. Does that make sense?
Thank you. Yes. And the last question is, what is your favorite tooth and why?
What's my favorite tooth?
Yes.
Tough question. My favorite tooth is obviously from the two of the three cases that we presented today. And what I do a lot of is this lateral incisor. I think this is, in my opinion, I think it's one of the most important teeth in the smile. I think it's one of the most often malformed teeth. Case number 3, case number 1, we can see that that tooth is smaller. I think it's such an important tooth in the smile. It's actually, just the anatomy of it. It's honestly one of the teeth that I focus on the most during all of my restorations. And let me see if I have it somewhere here. No, I don't have. It was a different slide that I have some written notes. That tooth we use the most notes. I like to use the most notes on, and it's one of my biggest reference teeth. And I kind of build things around it. Obviously, that and the center teeth, but that's definitely one of my favorite teeth. That's the one I focus on the most when I do any smile makeover.
So. Very interesting. Thank you, Dr. Mahmoud, for taking the time to talk.
No problem. Hopefully this was helpful. If I post a lot of the stuff on my Instagram. If you guys want to give it a follow, you'll see a lot of these cases frequently. As I do more of them, I continuously post them on there. So I think it's a little bit beneficial to see it. And feel free to DM me any questions that you may have in any of these cases.
For sure. Please follow Dr. Mahmoud on his Instagram. And a quick reminder to our viewers, the quiz is already up in our bio. Please take the quiz within 24 hours. And I want to thank you again for taking your time with us. Have a great day.
Thank you.